This is the Optimal Wellness Podcast, helping you achieve optimal wellness naturally, with your host, Dr. Clifford Fetters of Health and Wellness of Carmel.
Welcome to the Optimal Wellness Podcast, inspiring you to lead a healthier lifestyle. I'm Dr. Fetters, and with me today from Health and Wellness of Carmel, my co-host, Cassidy Waters.
Hello, episode 2. Here we are. So this month is February, and that is known as Heart Health Month. No pun there. So today we're going to just talk about heart health in general, what that looks like, what are the functional medicine practices. So first off, Dr. Fetters, let's just get into the basic anatomy, physiology of the heart, and how does the normal person monitor that?
Sure. Actually, before we even get started, I want to make my disclaimer that we're going to talk about heart health different than what most people have ever heard of. So if you're a heart patient and you're taking prescription drugs, you need to talk to your cardiologist or your specialist that's helping you with your heart condition and work with your holistic doctor to do the things we say and have them allow you to get off their prescription drugs. So number one, everyone needs a doctor. The average American no longer has a doctor. You know, back when I was younger, everyone had a doctor.
Yeah.
Everyone saw a doctor at least once a year. So I diagnose heart problems just from listening to people. There's people with cardiac arrhythmias and heart problems, particularly heart valvular problems, that I'm diagnosing, which I should never have to diagnose. So you need a doctor. They need to check your blood pressure. High blood pressure is never normal. You don't just take a blood pressure medicine. When you have high blood pressure, you have a problem that needs to be solved. Your heart rate. The average person should be around 60. If you're an elite athlete, okay, 40, 50. If you're not an elite athlete, you should not have a heart rate of 40. If you have a rapid heart rate, you have a health problem. So and then pulse ox, we can check oxygen levels. So they're just basic parameters. A doctor needs to listen to your heart to see, do you have a arrhythmia problem? Do you have a valve problem? Your basic parameters is a good start.
And it's not just people over a certain age, right? It's everybody should
absolutely.
With their heart health, right?
In pediatrics, I mean, they have pediatric cuffs, and there is, as you know, there's obesity epidemic, and children are getting type 2 diabetes, and the first thing you see is elevated blood pressure in children.
Are there any misconceptions about heart health?
I'd say the biggest one is it's not inevitable.
Yeah.
Any heart problems there's a root cause. And it needs to be evaluated. And you just don't take a drug because if you have heart disease, then you can have a heart attack, you can have a stroke. I mean, bad things happen from heart disease.
So is there, as far as the biggest thing is traditional medicine to functional medicine, how do they differ when it comes to your heart health?
Yeah, I think the biggest thing is if you have a blood pressure problem or any kind of heart problems, we do extensive evaluation of you. I mean, are you pre-diabetic? Insulin resistance, metabolic syndrome is a major cause of elevated blood pressure. Okay. And the root cause of that, the root cause of heart disease is inflammation, not a cholesterol problem.
Yeah, and that was what I wanted to talk to you about, because you hear so much about inflammation in your body and things like that. And I know that's a huge reason why so many people are turning to holistic medicine is they talk about how detrimental that can be to your health.
Right.
So can you elaborate a little bit more on that?
Sure. So elevated blood pressure means you have a problem. Same thing with high cholesterol. So you have high cholesterol, let's put you on a statin. It's like, no, why do you have high cholesterol?
Yeah. Cholesterol
is an anti-inflammatory. That's what it is. It's part of the immune system. So if you have high cholesterol, the first thing you want to look at is your immune system. So what causes inflammation? Heavy metals. Heavy metals in and of themselves cause that, particularly lead and mercury. But a high germ load, particularly Epstein-Barr virus, Lyme disease goes unnoticed all the time in America, and I'm sure other countries. Mycoplasma pneumonia, chlamydia pneumonia. There's these germs that they're simple blood tests to diagnose.
So is that's you do that when it comes to just labs in general, right? Because we talked about this last episode. You're going to do a lot of labs when you come here for the first time, and that's all going to probably be included, right?
Right. So all my patients, if they want optimal wellness, we do extensive labs. But if you're just looking at your heart, there's 5 labs you just have to do.
Okay.
The C-reactive protein for inflammation, that's very inexpensive. Fibrinogen, how thick is your blood? Every level above 300 increased risk of heart attack and stroke dramatically. Definitely lipid profiles, but with a grain of salt. We look at lipids different. If you have a high HDL, good cholesterol, people say, oh, that's great. But if you're above 80, you have Lyme disease or some other infectious process that's unusual to be above 80. Yeah.
Wow.
And then triglycerides. Triglycerides is more important to me than anything because cardiovascular disease is a lot related to your blood sugar and insulin levels. So your triglycerides should be below 100. So high cholesterol just tells me, okay, something's going on. And rather than, most of the time, I do not put people on anything to lower their cholesterol because once you get rid of the root cause, it will go down on its own.
So another thing I wanted to talk about was, on top of that, heart health, I think for the biggest thing people talk about is diet and exercise.
Yeah.
What would you say as far as nutrition, diet? What does that look like? What would you tell someone if they had heart issues?
Oh, yeah. So, exercise first off. Exercise is critical. Why is everyone taking semaglutide? Because it raises glucagon. So you understand insulin resistance means your fat cells are closed and won't accept any more sugar, so your body keeps pumping out insulin. Well, insulin is what causes heart disease. It's not the sugar, it's more the insulin levels.
Wow. And when he mentions a semaglutide, that is Ozempic or Wegovy is the other one, right?
Correct, right.
Okay.
So what does exercise do? We've known this for 30 years. If you can, every time you exercise, you're lowering your blood sugar. When your blood sugar gets so low that your brain needs more sugar, what does the body do? Your pancreas pumps out glucagon. And glucagon allows your pancreas to heal, reverses insulin resistance. So if people could exercise twice a day for 30 minutes, they don't need any drugs. They don't need semaglutide. They just have the discipline, even 20 minutes, even high intensity training. Even if you do the 10 minutes, and we'll talk about that later, about high intensity for 10 minutes, yeah, be in shape, don't overdo it, but as hard as you can for 30 seconds, rest for 30 and 10 minutes, an exercise, you can't hurt yourself, working very hard. That alone raises glucagon levels and helps reverse insulin resistance and even diabetes.
Yeah. Well, and so I teach cycling and I know cardio because cardio is my least favorite thing to do, like most people. I try to just pump it out as quick as I can, but they talk about how good that is for your heart. But now I've heard a lot about interval training, which HIIT is high intensity interval training. That's what that stands for. That's what he was just talking about, those 20-minute spurts of intense activity. And they talk about how good that is for your heart as well.
Yeah. Yeah, but exercise, it's everyone's individual. See, I was a runner my whole life.
Yeah.
So I rollerblade, I run. So 10 minutes, my joy is exercising. So I will rollerblade on a weekend for 2 hours straight or cycle for hours.
Yeah.
So hopefully exercise is a hobby and it is something that can be joyful. So what do you enjoy? I mean, if you, I have some people that hate walking, but you have to find something the least,
right.
I love everything, but some people don't like to even move. So what's the least abrasive to you? So, but you need to move. We're human beings and we're animals.
Yeah. And
animals need to move.
Yeah. Just moving that body, even gardening. I know a lot of elderly people like to garden and that's a huge one. It's just moving your body. So on top of exercise, is there anything diet related or nutrition related that you would tell people because I know in the traditional world, it's like, hey, watch your red meat, watch this.
Right.
Is that similar in the functional world?
Yes. But again, it's individual. There's 3 metabolic types. There's the carb type that can burn carbs. I'm the exact opposite. I'm the protein type. So if I do the vegan diet, my blood sugar crashes. I feel horrible. If I eat a grass-fed steak, I feel like $1 million. So, but there's something called the blood type diet, but it no longer works because in America, we're all a bunch of mutts. So even though I'm A negative, which should be a carb type, I cannot survive on carbs.
Yeah.
So you find out, how do you feel the best? So the best way to find out if you're going to give us, like you're going to be at a wedding, you're going to give the speech of your life for your best friend at 9 o'clock in the evening, what are you going to eat at 6 p.m. and nothing after that to feel great for the next 5 hours?
Wow.
So me, it would be steak, a lot of fat, very little carbs.
That's me.
Okay.
For one of the I'm a fats girly. I love my fats, love my protein.
But there are some people, particularly women, that say, oh my gosh, if I eat that, I'd fall asleep. I would feel terrible. Yeah. So that's the first way. So you find out what's your favorite diet, do you feel the best? Where do you feel best if you exercise? And then you do your lipid profile, all the blood tests that I want you to do and see where you are. The A1C is critical to an insulin level. That really tells you where your blood sugar is. Because
good to know.
Back in the day, people would cheat with their If they're diabetic, they wouldn't eat for 24 hours, come in, I'd check a blood sugar, but you can't cheat because A1C tells you what your average blood sugar has been for 3 months. That's critical. It needs to be less than 5.5.
That's a really good point, I think, because on social media, you see it's so overwhelming of like, you need to eat this, you need to not do this. And so how would I find out what type of person? Is that a blood test? How would I do that?
Right. Yeah. I hate it when people say, you need to do this.
Right.
No, you is not everybody.
Right.
Yeah. So a blood test, if your triglycerides are 300, you're not a carb type.
Yeah.
Because that means you can't burn sugar, and that's why it's so high. So just based upon your blood test, what is your lipid profile and the triglycerides and insulin. I have people that are overweight, yet their A1C is better than mine. And guess what? So they can probably do the carbs. But so it's just, you just have to find out what's best for you based on, number one, how you feel and your blood test. And the main thing is your insulin, A1C. If you really want to get fancy, you drink the glucose tolerance test, 25 grams of sugar, and what's your insulin blood sugar 1 hour and 2 hours later, and that will tell you a lot.
Yeah. They make you do that when you're pregnant, just so you know. I had to do it 3 times. Do you have any success stories specifically with your patients with their heart health after seeing you?
Yeah, sure. So cardiovascular disease. If you have a family history of heart disease at a young age, you need a calcium heart scan. So if you're a 40-year-old man and your dad died of a heart attack at 45, you need a calcium heart scan. Very high-tech CT scan that specifically scans your heart, only takes a picture when your heart's relaxed, and we get a calcium score of your coronary arteries, the individual ones, from 0 to 6,000. So if you're a 0, you and I have time, we can do this. But if you're in the thousands, you and I have a lot to do right now. And from there, you see me, we spend a year, and in 1 year, you recheck the heart scan, and it's better. So I always tell my people, tell the staff people, can you look and see what my previous level was? And every time the staff member goes, you can't reverse it. Your numbers are better. It's like, that's not possible.
Yeah.
But it is possible. But the traditional medicine just accepts it and does prescriptions. But our goal is to reverse it. And you can reverse heart disease simply by using diet, exercise, and there's certain vitamins and nutrients that really help the heart.
As far as, I know we'll get into supplementation a little bit later, as far as I've seen a lot of stuff about red light therapy, things like that that can help with your heart health. Are there any other things like therapies that are functional that you would suggest?
Infrared saunas.
Yeah.
And most infrared saunas now, and I prefer the portable ones because I can go at 170 degrees for an hour, and you don't want to heat your brain at 170 degrees.
Yeah.
And you off gas toxins too. So our infrared sauna, has a neck collar, so we can breathe and feel better as we're sweating out toxins. The red light stimulates your mitochondria, which is critical for the energy of your body and your heart, and also the energy the cells can pump out toxins from your body, including heavy metals. The environmental toxins come out. So it's probably the best detox in the world is a high quality infrared sauna. EMF free is the key.
So as far as what that infrared sauna looks like, is it just like going to the sauna at the gym, or what is that like?
Yeah, a lot of gyms have it. I personally prefer not to sweat, and other people sweat. So a super high quality one's around $1,200. So basically, it's a small footprint. I mean, it just goes around. Maybe it's 3.5 to 4 feet wide and 4 feet in length, and it comes to your neck, and you just sit there. It goes all around you, zips up. There's a little hand. So if I have to, I've done Zoom conferences where they have that on there. But there's actually, they can just, there's apps you can just look at your face. They don't know what's happening.
Only you.
Or you can actually have it so they're not seeing you, just are listening in. Or you can do your work. I can pull up my computer. Again, it's usually a time to relax. Just relax and meditate, but it just melts away the tension. I mean, literally, I have so many people tell me they look forward to doing the infrared sauna more than anything else. They sleep better, they feel better. Oh, and for those women that want to lose weight, you burn 500 calories every time you do it.
Yeah, I have heard that.
You have women that do it 7 days a week because they'll burn 35. That's a pound a week.
Yeah,
it's a pound a week just from doing that. And guess what? It's getting rid of those fat cells, and therefore your insulin resistance goes away, and it just helps you lose weight. It's dramatic.
I know another big issue is hypertension, and I truly have no idea what that means. Can you go into what that means?
You mean what? Hypertension? Yeah, it's elevated blood pressure. Your blood pressure, the top number should not be over 140. The bottom number should not be over 90 usually, the baseline. When you exercise, it's going to go up. But obviously, the higher your blood pressure, the more pressure on the arterial walls, and you don't want them to rupture.
Right.
And when they rupture, that can cause a stroke or a heart attack. So you don't want to have excessive stress to your blood vessels and wear them out.
Do you guys have a certain treatment for that?
Yes, I mean, first, the basic parameters of functional medicine, just getting away the inflammation, get rid of the root cause, and then that alone should do it. But along the way, most people are short of magnesium. And magnesium is called a calcium channel blocker. It works just like prescription drugs to just relax the blood vessels.
Yeah.
The average American's way deficient on magnesium, which helps you relax and calm and get you out of that sympathetic overdrive state. So magnesium is probably number one.
Yeah. I love magnesium. I started taking it with my first pregnancy, and I've never it changed the way I sleep. Yeah.
Right. And what premature labor, even back when I was doing OB, they would give you magnesium because it calms those muscles down.
Yeah.
And people with muscle cramps think they need potassium, but it's usually magnesium that they're short of.
So another big point, I think, again, on social media, what people talk about is stress and emotional health and how that affects not only your mental health, but your heart. Can you talk a little bit about that?
Sure, yeah, right. Stress and in holistic health, stress is number one. If you can't deal with the stress, well, how can you be a good patient and do all I want you to do if you're stressed?
Right.
If you're living fight or flight for the moment to moment, you don't think about, what's going to happen tomorrow? You'll eat anything just so you can survive. So you have to get out of that survival mode.
Yeah.
So what happens with stress? You increase your cortisol. Cortisol increases blood sugar. Elevated blood sugar, fluid retention, then it raises your blood pressure, then it raises your triglycerides. It's this cascade of nothing good happens. And the number one test for whether or not you're going to have a heart attack tomorrow is the beat-to-beat variability on an EKG. So you should have this perfect balance in your nervous system between parasympathetic, go faster, sympathetic, faster, parasympathetic, slower. So you have this balance, and people who are healthy, it goes, you don't want a heart rate, bump, bump, bump. You want bump, 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 bump. And children have this, it's like, hey, you think they're in an arrhythmia, but they just have this perfect balance. But if you don't have the balance, you're just sympathetic dominance, and you're just, all this cortisol's pumping out, increased risk of arrhythmia, even lethal arrhythmias, and elevated blood pressure, and they say it's just horrible for your blood sugar.
Yeah. And so that fight or flight everybody talks about, that's that parasympathetic, sympathetic,
right.
Correct?
And sympathetic overdrive is the fight or flight.
Okay.
And the parasympathetic is the kumbaya, relax. They should be in when you sleep.
So last thing I want to cover, supplementation.
Mm-hmm.
What supplements? We talked about magnesium. What are some other big ones you should be on to keep your heart healthy?
I think it's partly immunity too, because when the germs are out of balance, they cause inflammation. So everyone should be on the basic immune pack we talked about last time, like vitamin D, K2 plus D. Vitamin D is so amazing. It actually lowers cholesterol, lowers blood pressure. K2 is critical. There was a time we gave women just pure calcium and vitamin D without the K2, and guess what? Their heart rate is just a linear increase in cardiovascular disease. So you have to take K2. Your calcium supplements should be like ours is bone builder. So you have all the different minerals for your bones, not just calcium.
Okay.
So and then just a multivitamin that helps the methylation cycle, and the methylation cycle allows you to heal your body. So pretty much all methylated multivitamins, the more expensive ones, because methylated vitamins are more expensive. And then probiotics, believe it or not, probiotics lower your blood pressure.
Yeah.
Just a healthier gut, healthier body, less inflammation. It's dramatic. But then for your heart, especially if you have heart disease, the first thing you think is magnesium, but also nitric oxide. Nitric oxide adds oxygen, relaxes the blood vessels. What does Viagra do? It does nothing. It's just nitric oxide. So therefore, every blood vessel in the body works better when you raise nitric oxide. So that's critically important.
Wow.
Aged garlic reverses heart disease dramatically. Curcumin stops inflammation, dramatic. CoQ10, L-carnitine increases the fat going into the mitochondria that gives the heart more energy.
Yeah, and those are all over, and you see like bodybuilders and things like that. I know they talk so much about L-carnitine and CoQ10 and things like that. So that's good to know why that actually does that. You can hear it from a doctor and not on social media.
Yeah, and lastly, D-ribose. You've heard of D-ribose? Yeah, the backbone of ATP. It's just a carbohydrate complex, which is the backbone of ATP, which is the ultimate energy source of the human body. And you just take that for heart patients, particularly congestive heart failure. 5 grams 3 times a day, and it increases cardiac function. It's not expensive, and it's dramatic for heart failure.
So I definitely think we should talk about how when you come here and you're a patient, you get a very detailed list of whatever he suggests that you take. So any supplementation that he suggests, it will be documented.
If you want some examples, I've had people with congestive heart failure that they were on the transplant list and they didn't want to do that. And they both had, what was the root cause? So the cardiologist said, yeah, you already had cardiovascular disease, but now you had a virus, and the virus was the last straw. So what do we do here? Well, we treat viruses, we eliminate the virus, and we reverse heart disease with the supplements we spoke about. We control the blood sugar, and I've had people that have come to me waiting for a transplant, was able to not have the transplant.
Yeah. Wow.
But they were highly motivated people,
Sure.
and they were, mobile, and they were not, wheelchair bound. But there is a treatment for pretty much all cardiovascular disease.
Wow. That's awesome to know, because I think once you hear there's something going on with your heart or someone that's such a scary, and everything here too, this is all the stuff that he talks about is available here at the office, correct? All the treatments, therapies, things like that, those are all available. So for the month of February, we are doing a supplement store promo, and it's BOGO, buy one, get one, 20% off. The code is HEART, and you can use that online all the way through the month of February. Thank you all so much for joining us for the Optimal Wellness Podcast, brought to you by Health and Wellness of Carmel.
Subscribe now to get monthly episodes to help you achieve your wellness goals. And if you'd like to learn how we can help, schedule an appointment at Health and Wellness of Carmel today. Just go to HWOFC.com or call 317-663-7123.